Right, good afternoon, guys, and welcome to the Tuesday afternoon kitchen talks. My name is Paul Corliss, and I'm a healthy lifestyle advisor at Your Live, where I deliver cardiac and cancer rehab. So today, I'm very excited to introduce is a cardiologist, Dr. Zarrin Shaikh, from a cardiologist from down south in London. Did I pronounce your name right then?
You did.
Oh,
very
fantastic! Yes.
Well done.
Over the last couple of weeks, we've been delivering different health talks. We've had sleep specialist doctors. We've had another cardiologist called Dr. Ahmed Farak. We've had professional athletes. We've had dietitians, all different guest speakers coming in. So today we're going to talk a little bit about heart attack prevention. And we're going to talk a little about honesty as well, about being honest in your health. And we'll get onto that shortly. So, and you're an imaging cardiologist. You're the cardiologist, Dr. Ahmed Farak, we had. Is a slightly different cardiologist. You all generally do cardiology work, but you take images of the heart as well. So tell us a little bit about what you do day to day.
Yeah, so we do a lot of general cardiology. So if anyone has a cardiology symptom or sign, then you come into hospital or an outpatient clinic. I'll see you, assess you, and decide what you need. Often it is imaging as the next step. And what we mean by imaging is taking pictures of the heart. So we're a bit like the paparazzi of the heart. We take pictures using lots of different techniques. Some of them are ultrasound, so a bit like a pregnancy scan when people go in to look at babies. We just look a little bit higher up through the chest wall. Yeah. We can also look with CT scans and get really lovely pictures of not just the heart, but the arteries of the heart muscle. And we also can look with MRI. And that's a very good technique to look at the structure and the function. So we combine all these approaches to get a real feel for what might be going on and causing those symptoms.
Yeah, absolutely. Yeah. Obviously, heart attack in the world is obviously the leading cause of death. It's still higher than breast cancers. And it was interesting to see on one of your other podcasts was there's more ladies die of heart disease than they do of breast cancer.
It's staggering, isn't it? And it's not something that we mentally associate with women as well. And I think that's why sometimes women are actually underdiagnosed. Firstly, because mentally we have a picture of a middle-aged man clutching his chest, sweating with, a tight band around him. So we have that mental image. And secondly, because sometimes the pain that women have is slightly atypical, it doesn't always fit the normal pattern. And so as a kind of community, we've just got to have that higher index of suspicion.
Yeah, absolutely. You always think about men, don't you? Men is the overweight. You see, they used to say the apple shape rather than the pear shape. Is this much theory in that? Obviously, the government's just released a new obesity strategy, but obviously men putting weight on around the stomach area. Is that a high risk of heart disease, and women who put the weight around the bum area and the leg area?
Yeah, typically if you tend to put weight on around your abdomen, around your tummy area, and you're slightly more what we call apple shape, then you have a higher chance of actually you deposit fat in your tummy in that area. You deposit fat also in the arteries in your body, and some of those could be the arteries of your heart. So that does actually lend you to having a slightly higher risk of heart disease, in particular disease of the arteries of the heart.
Obviously, on the other previous podcasts, we've talked a lot about nutrition. Obviously, losing weight, obviously, is a massive thing as well. And if anyone wants to research a bit more about losing weight, we've got some really good podcasts, and we've got one from our colleague, Dr. Tom Butler. So have a read back of a couple on our podcast page, and there's some really good nutrition ones. There's quite a lot of complementary information out there, isn't there? Obviously, should we be eating too much fat? Should we cutting down? Is fat going to go straight to an artery as well? There's a lot in the media about sugar as well. What's your thoughts on from a cardiologist point of view, from a nutrition point of view?
Yeah, I mean, I think first of all, we are all different. We all respond to different things, and different approaches work with each of us. And to say that there is one diet that will suit or cure everyone is very difficult, and it's just wrong as well. And it doesn't always fit into the values or the affordability or the time commitments that people need. And so I think when you're talking about public health messaging and giving, you know, sensible advice, then there are real good evidence-based things that can really help, like increasing your fruit and vegetables will always help. Increasing the fatty, good fats, so fats from, say, you know, salmon and mackerel and your omega-3s, nuts, seeds, increasing the fiber in your diet, and then just decreasing all those, you know, fatty, processed cake, anything with like that comes in a packet with lots of E numbers. Generally, if you live by that, then you will optimize your health. If a specific diet or way of life works for you, then by all means investigate it, because we're all different.
Yeah, absolutely. Yeah, obviously diet's a major part of one of your pillar approaches as well, and obviously exercise is a massive point for heart health as well. And for me, I can't stop. I've just come back from a run and changed my towel, that's why I can't stop sweating at the moment as well. So I had a quick half an hour run before we did the podcast. But obviously exercise at the right level is major important, and that's where teams like our teams come into part, is obviously cardiac rehab teams as well, especially if you've had a heart attack. You're thinking, is it safe to do this? Or when someone's just had a heart attack, am I okay to go for a walk around the hills? Am I okay to do this? It's that fear of obviously building that confidence back up after you've had a heart attack.
And that's why programs like cardiac rehab and the things that you put out are so important, because often when you've had a heart attack, it's a confidence thing. You just lost all confidence. You don't know what's right. You don't know what's going to bring in anything else on. But actually being active and listening to your body is the best thing. So, you know, knowing that you'll have good days and bad days, knowing that that's acceptable, and knowing that if you feel that you can go a little bit further, you can walk a little bit further, you can, you know, increase your pace a little bit, then that's great. If you don't feel like you can do that, then stop, and that's fine. Just building it up gradually is the way forward.
Absolutely, yeah. And looking at, obviously, we talked about your nutrition's one of your pillar posts. Obviously, it's sleep, and we did a sleep podcast a couple of weeks ago. But obviously, you're a little bit of a sleep specialist, aren't you, Zarrin? So
my PhD was in sleep. Right, it's a particular pet topic of mine.
Yeah, I think sleep is absolutely massive into it, because I think sleep's going to affect the way how much exercise you do on the next day. It's going to affect your mood. It's going to affect what dietary choices you may do in the day as well. So obviously, and there's a lot of research around, obviously caffeine's a big one. Yeah.
And what we're now learning is different people metabolize it at different rates, but you know, it sticks around in the body for quite a long time.
Yeah, after 2 o'clock in the afternoon, so we should be really looking to knock your caffeine on the head.
Absolutely. I can't have a coffee after 2 o'clock. I stay awake all night.
Yeah, and room temperature as well. Temperature plays a massive part as well, I believe.
It does. So the things that, you know, if caffeine's in your body, then obviously that's going to keep you alert and awake. What we sleep is, if you look back to how we evolved, and what we, you know, as cavemen used to respond to, then that is what we actually still respond to. So at nighttime, what used to happen is that the sun used to fall and we used to be outside as cavemen, and the temperature would go down. So we're naturally inclined to sleep at a lower temperature, and things like opening windows, having a bath sometimes helps because that releases heat. So temperature is really important, and light as well. So we're not evolved for this we're evolved for natural light. We're not evolved for phones, mobiles, artificial lighting. And so keeping things really nice and dim and dimly lit at night, having, you know, a curfew on when you watch screen, that's all really helpful.
Reading time and getting rid of your mobile phones and things like that.
Yeah.
Obviously, and one of the other parts I really want to talk to you today is a bit about honesty and being honest with yourself. I know you changed happiness to honesty, and it's something I've been thinking a lot about this since we arranged to meet, about honesty, and actually how honest are actually patients with you sometimes. And I think us as professionals, we have to be very honest with patients as well, and it's being very tactical how you are honest with patients. But Tell us a little bit more about that last pillow in your.
Of course. So, I mean, as you mentioned before, I'm an imaging cardiologist, but I've become over the recent years really passionate about prevention and prevention of cardiac disease, specifically because it is something that we can work on to prevent. It's the biggest killer. And so I really had to think about what different pillars affect your overall health, not just your heart health, but your overall health. And as you mentioned before, food is one of them. So it forms the acronym FRESH. That's the Fresh Heart Project. So F stands for food, R stands for relaxation and stress management, E stands for exercise, S stands for sleep. And, you know, we think all these pillars you've talked about, haven't you?
Absolutely.
H used to be happiness. And I mean, I loved it when I thought of it. And as I went on, I just thought that's not a very effective pillar, because you don't want to force happiness if you're not happy. That just makes you even more miserable. And I'll never forget, I went and gave a talk to some retired individuals, and they said, you know, I went through the Fresh Heart approach, and I went through happiness, and these are the things that you can do to kind of maintain your optimism, and you know, it's related to good cardiac health. And one of the ladies afterwards said, but I'm bereaved, I can't think of being happy, how can you do that? And I felt really disrespectful, and I felt like that's just a wrong pillar to aim for. And instead, I really had to think about it and reflected on what is really important in health. And a lot of it, I think, boils down to honesty. And honesty is being honest with yourself about what you can actually achieve, being honest with yourself about where you are, being honest about what got you there, what the factors are, and some of them are not related to you, because, you know, it's not your fault if you can't afford to go to a gym, and you can't afford, you know, your job involves shifts, so that means you put on weight. That's not your fault. It's being honest about what is under your control and what's not under your control. And then when you're honest, you genuinely know what your motivations are, what the reason is for getting you to where you are, and what you want. What do you want? What are your health goals? What are you realistically going to work towards? And what can you realistically do? I think it's such a better starting point to then progress and build on that and say, yeah, so this is where I'm at now, and this is me being honest with myself, and this is where I can honestly go from every aspect of life, from a time perspective, from a financial perspective. And then it kind of takes away from the pressure of it all, because you don't want to be blaming yourself for where you're at all. It takes away from the pressure of trying to optimize your health in a way that's not suited to you at all. You know, I mean, I remember, I think we chatted about it at the beginning, about how after I gave birth to my son, I put on weight, and I joined a gym. So I was like, I'm gonna get rid of it. And I was miserable. Firstly, I wasn't losing weight. I was just, you know, eating to compensate afterwards. And I wasn't seeing my son and husband as much. And what I really genuinely wanted to do, if I was honest with myself, is spend time with them, rather than running off to the gym with the little time that I had. So I cancelled my subscription, and I was just so much happier. And I thought, you know what, I'll try and, you know, build this back up at some other point, or do it in another way. But being honest with yourself takes away that pressure, and means that you're doing it in a way that's right for you and sustainable for you.
I think it's really interesting, because I think we're quite guilty sometimes, especially in cardiac rehab, when someone's had a heart attack. Right, that's it, you need to stop smoking, you need to exercise this time of the week, you need to stop eating out that. And I remember a patient once saying to me, the same again, he was bereaved, and he ate out 4 or 5 times a week with friends. And I was saying, it's not really doing you any good, this. Your HbA1c's gone up, your blood sugar level. And it was, he says, well, this is what I do now. I go out with friends as well. I was like, okay, what can we do to curb that then? What changes can we make to keep doing that then? So we looked at it from a different angle. So that's brilliant. So that's a little bit about prevention. Please, obviously, we'll post Zarrin's 4 Pillars podcast link below ours when we share this one today. Obviously, cardiologist Dr. Ahmed Farag showed us about checking the pulse and blood pressure is massively important. And obviously, should people start getting worried when they come to see a cardiologist? Obviously, if you went to your GP because obviously you felt a little bit funny, obviously we know the crippling chest pain, the jaw pain,
Yeah.
all the textbook symptoms. People know about a heart attack, pain down their arm, shortness of breath, these type of things as well. But obviously, if someone says, I feel a bit funny, I think we all sometimes feel a bit funny in our chest, don't we? Is that, I think sometimes
we do.
gastric problems, could be muscle, these type of things. But
Yeah.
when people are more terrified when they come to see a cardiologist, I think.
Yeah, especially because it's your heart, isn't it? And you think, oh God, is there something wrong with my heart? What's going to happen? Is this it? Is this the end? And you really, you know, all those things go through your mind. And then right now, if you then Google what the possible outcomes can be, Dr. Google is not your friend at all. And so there's already a level of anxiety. Often when people come to see us, it's for things like chest pain or breathing issues or palpitations where you have a real awareness of your heartbeat, or you might be feeling faint or collapsing, those sorts of things. So you come and see us for those complaints. And what we then do is we'll go through everything with you. We'll order some tests and hopefully put forward a plan. Quite often, it's a plan that we reassure you. Quite often, you know, those odd aches and pains here and there, that odd bit of breathlessness, that odd palpitation, quite often it's not really coming from your heart, because there's a massive connection. We are, you know, when we're unfortunately all siphoned off now, so I deal with the heart and someone else deals with the gut and someone else deals with the lungs, but we're all connected. And the heart is one of those integral centerpieces of that connection to everything. So often when there's a problem in the gut or problem there or somewhere else, we feel it. Often when there's a problem with stress, often then we're anxious about something, we can manifest that in lots of different ways. Some people have gut issues. I know I have gut issues, but you know, some people actually get chest pain or palpitations. And then what we can do after we've reassured you is say, okay, fine. So it's not coming from your heart, but what do you think is going on that we can address that, you know, it is coming from? And that's a really reassuring thing to happen. So you've gone through the whole process, come out the other end, and actually your heart's okay. That's often what we find.
Yeah, absolutely. So it's a reassuring. So obviously people do have symptoms, GP is the first port of call, and then hopefully they come to see one of the happy cardiologists at your local hospital. So that's great. So I've said, what prevention, obviously we always say is better than the cure. And what about these people who used to say, obviously we know people with poor lifestyle, and I know another cardiologist friend, he used to say to me, your genes load the gun, your lifestyle pulls the trigger. But sometimes you see the people who are quite thin, they're quite athletic, and all of a sudden they're having a heart bypass. As well. Obviously, and they sometimes get no symptoms, all of a sudden they have a heart attack, and they're on to see the cardiothoracic surgeons. So what should these type of guys be looking out for? Or should they be at a certain age? Should they go and be requiring a certain test or anything like that?
I mean, what I would say is I've seen quite a lot of people who are young, but if you lead a fit, healthy, active lifestyle and, you know, you optimize all the things that you can, then the chances of that happening, you know, younger are lower. And if you don't do that, then we'll see you a lot sicker. The second thing to say is that you can do all you can, but you can't change your genes. You can't change those. And that's not something that you should blame yourself about either, because there's a lot of people who are thin and active and do everything, and then they come in, they're like, well, what was I doing wrong? And it's not something that you're doing wrong. It's just that, you know, you've got that family history. Sometimes when you think, oh, I've got an active lifestyle, so you're looking at the pillars of fresh, so your food is optimized, you're exercising. But sometimes people are just so stressed all the time, so you know, you're not sleeping well, and as a result, you know, there's this low grade inflammation in your body that's kind of causing a little bit of coronary disease here, that a little bit of flaring up. And so it's not a short-term thing, that's over many years, that's a long-term thing. So often it's not things that we talk about, and they may be quite sort of hidden, and it's only when you start talking to someone that you realize, yes, you've got a genetic predisposition, but you were really stressed and really leading up to it.
Absolutely, yeah. And obviously, when you get to a certain age, should you be going to seeing your GP and saying, should I get a checkup? My father had a heart attack, my mother's got angina, as they say. Should you be going getting certain checks? Should you keep an eye on your cholesterol level? Or there's a lot of research about, obviously, sugar and being pre-diabetic, so it's increasing your risk. And you sort of see the metabolic time bombs, don't you? So the overweight people on the 4-metformin a day, the diabetic medication, the Ramapil, the high blood pressure medical, they're sort of like the time ticking bombs, aren't they? So at a certain age, we need to think, I need to go and look at my cardiac risk score and see if I'm going to be at a risk of what changes that I can make.
Yeah, I think it's always important to keep an eye on it. If you look at your parents and they've had issues at a young age, you figure out what age they were at. You can kind of gauge it by that. I think if you're 40, there's no harm in getting a cholesterol check. There's absolutely no harm in saying, you know what, I want to just get a routine set of blood tests to see where I am. Obviously, if you, and this is really if you've not got any symptoms. If you've got symptoms, then it's always worthwhile. And by symptoms, I mean, oh, you've got that odd bit of chest pain, you're a little bit breathless, you might get the odd palpitation here or there, awareness of your heartbeat. Then that's when it's important to go to the GP and say, these are the symptoms I'm getting, and they'll routinely check your blood pressure, do a set of blood tests, and then find out what is going on or whether anything needs treating or addressing.
Yeah, fantastic. Right, guys, so thank you very much, Zarrin. So obviously, please have a look at the 4-pillar approach: nutrition, sleep, mindfulness, all sorts of things, being honest with yourself. So I really do like that one. Obviously, any symptoms, please go and see your GP, obviously, and have a chat with them. And even to get referred to a cardiologist, they're not scary people, they're very nice people, just for some reassurance as well.
They're very nice.
Yeah, very good. So thank you very much then, and hopefully I'll speak to you again soon. So thank you for coming on.
Absolutely. You're very welcome.
Yeah, and please check out Zarrin's podcast. She does them quite regular, some really good ones on YouTube and Apple iTunes, these type of things. Thank you very much.
Podcast.
Yeah, thanks for coming.
Thank you very much for having me.
Thank you.